Hello parents, how are you doing? Welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. Today's video is all about oromotor stimulation, and that's why I'm prepped up with my hand gloves. Yes, in today's video I'm going to demonstrate you how you can stimulate the oral muscles of your child who is suffering from cerebral palsy. Now, when a body suffers from cerebral palsy, this is an upper motor neuron lesion, also a problem within your brain. Now, whenever the problem is within the brain, mostly there are tone related abnormalities seen in the child. This could be spasticity, dystonia, ataxia, which makes the facial muscles tone very high, due to which child finds difficulty in doing oral activities efficiently, and most of the time the child would be a mouth breather. Now, there are itself a lot of complications and problem associated with mouth breathing. Hence, it's important that the child should be encouraged to keep the mouth closed, breathe from nose, and at the same time use the oral muscles efficiently. So, today I'm going to give you some practical tips that will help your child to go through all this process. So, without wasting due time, let's get started. So, when you are practicing oral stimulation for your child, there are few things that you should consider in your mind. Number one, whenever the child sleeps, keep a tape around the mouth of the child so that while sleeping the mouth does not open if they have the tendency of keeping the mouth open, because that's a very common pattern that is usually seen. Second, you can try keeping mouth guards, which are very easily available by dentists, which are basically devices that keeps the mouth closed. Encouraging the facial muscles and the breathing muscles, or else breathing from nose, is very important step when you are training your child. You can also teach your child to do nasal breathing exercises when the child starts understanding your commands. Maybe when the child is very small, they might not follow, but if your child is about 3.5, 4 years of age, then definitely encourage your child to practice breathing exercises. That will also help to relax facial muscles and will help to improve facial functions. So, simple way of doing breathing exercise, nothing fancy. Ask your child to sit down, you sit in front of the child and make them do deep breathing. You can also keep a toy on the tummy of the child and make the child to do breathe in and breathe out when the child is lying down from the nose, because when they will breathe in, the tummy will move up, when they will breathe out, the tummy will go down. So that would be a very good way of engaging the child in doing that activity. This will itself encourage oris muscles activity. So that is the first thing definitely you should do. The second thing that you should do before starting any of the stimulation exercises is to gently massage the facial muscles, because that will stimulate and increase the blood circulation and also increase the awareness. Now, when I say massage, that doesn't mean hard massage or so. Simple stroking is something that you have to do. The reason you have to do in the center direction is because we want mouth closure to happen. That's why take hand and gently first stroke with your hand the cheeks of the child. 1, 2, 3, 4, 5. Similarly, you will stroke here. 1, 2, 3, 4, and 5. Similarly, use firm but comfortable pressure and stroke here. 1, 2, 3, 4, 5 here. 1, 2, 3, 4, 5 here. 1, 2, 3, 4, 5. So this forms the first stroking. Now the second task is stimulation itself. Now in stimulation, we need to develop awareness of certain areas and certain muscles of the face, especially the cheeks muscle of the face. For this, you will use your hand and finger. if you feel child is not comfortable and not allowing you to do that, make sure to dip your finger in little bit honey and then do it, and make your child sit in this position while doing this. Don't make the child, or else don't do this activities when the child is lying down. Make your child sit, hand well placed, and then only do it. So take your finger and then 1, 2, 3, 4, 5. Same way you can do here. 1, 2, 3, 4, 5. Then you will do upward direction. 1, 2, 3, 4, and 5. Here 1, 2, 3, 4, 5. Then you can use the thumb and stimulate around the mouth. 1, 2, 3, 4, and 5. Now what you are doing is you are increasing the awareness of the child with the help of your finger and certain sweet texture that you will get with the help of honey. Now in order to encourage mouth closure, what you can do is you can use 2 tips of finger, dip it in honey and just stimulate here. You are applying honey in the upper lip and the lower lip and just stimulating or stroking it. As the salivation will happen, the child will encourage his mouth or her mouth to close. Initially you might not observe movement, but as you practice this again and again, that will help the child to activate. And the last thing that you have to do is to encourage the tongue movement. So in order to do that, again you will take a finger, dip it in honey and keep it here. So the child will bring the tongue at that area. Wherever you will place, the child will bring the tongue there because of that sweet taste. So do this practice 2 to 3 times in a day. Make sure don't take too much of honey because that might cause cavities in the teeth, and at the same time, if the salivation happens more, the child can aspirate. So make sure that you do this first, the child in sitting position, and second, make sure to take consent or take help of your therapist while doing this exercise initially, then only start by your own. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.